Hello, fellow preppers. 'Tis I, TheRumpledOne. Basic Disaster Life Support Course Manual 3.0 from the National Disaster Life Support Foundation and the American Medical Association. Chapter 9, Biologic Disasters. Okay, we're going to talk about the principles and practices for the management of biologic disasters. Okay, biologic agents are bacterial, viral, fungal, parasitic organisms and toxins that cause disease in humans, plants, and animals. Okay, for humans, these diseases can spread directly or indirectly from one person to another, as well as can be transmitted from animals, insects, plants, or contaminated food and water. And these infectious diseases are a continuing threat to all persons regardless of age, gender, lifestyle, ethnic background, and socioeconomic status. In other words, biologic disasters don't discriminate. They hurt us all equally. Okay, now, let's talk about the basics of infectious disease exposure and transmission. Okay, the chain of infection. First we have the infectious agent, okay? Then we have the reservoir. In other words, that's where these biologic agents sit. Like it could be a person, an animal, a plant, or a substance. Then they have to have a portal of exit. They have to be able to leave this reservoir. Then there's the mode of transmission. It can be airborne. And that's just one way. It could be a droplet. It could be direct physical contact. Or it could be indirect physical contact. For example, if somebody's infected and they touch this and somebody else comes along and touches it, that's called indirect physical contact. They can have fecal oral transmission. Contaminate would be contact with contaminated food or water. Or vector-mediated transmission. That can occur via infected insects or other animals. It can happen to a bite. So those are the modes of transmission. The next is the portal of entry. That can come through the skin, mucous membranes, lungs, gastrointestinal tract, or it can also come from tubes that have been placed in the body or punctures. And so some agents can only affect you if they go in one part of the body, one specific portal. There's other ones that can go in any portal. And finally, the susceptible host. So that would be us. We would be the susceptible host. Now, some things make us more susceptible. For example, genetics, skin, if we have the proper immunization, or there could be some type of medical condition, malnutrition, pregnancy, age, increased exposure risk. It could be either occupational or some type of travel. And behavioral factors, whether or not you wash your hands, your respiratory hygiene, your sexual behavior, and drug use. Now, what type of biological disasters are there? There's epidemics and there's pandemics. Okay, an epidemic is an illness or other health-related issue that occurs in higher numbers than would be expected normally within a country or region. A pandemic is a worldwide epidemic. Okay? So for a pandemic to occur, a new disease has to emerge to a population that has little or no immunity. The disease is infectious for humans, and the disease spreads easily among humans. And so basically, I guess in the 1900s, other than the bubonic plague, all the epidemics and pandemics were influenza or the flu virus. The biologic disasters also include bioterrorism, where somebody uses a biological agent intentionally to cause harm. Now there's three types of biological terrorism threats. There's category A, high priority agents, B, second priority agents, and 3, third priority agents. And category A, of course, is the highest one. That includes things like anthrax, botulism, plague, smallpox, and some others. Okay, situational awareness and detection. So what are the clues? An increased and unexplained death, the unusual age distribution of the patients. In other words, severe illness among persons 20 to 50. Unusual seasonality, for example, severe widespread respiratory illness during the summer months. An unusual manifestation of disease, such as the occurrence of an animal die-off. So in other words, this is what you need to be on the lookout for to detect biological disasters. Okay, so in triage, we have 5 things to look at. Susceptible, people who haven't been exposed but are susceptible. Exposed, people who are susceptible and have been in contact with an infected person. They may be infected but are not yet contagious. Infectious, people who are symptomatic and contagious. Removed, people who can no longer transmit disease to others because they have survived and developed immunity or died of the disease. And vaccinated or medicated, people who have received prophylactic medical intervention to protect them from infection. Now, basically, one of the things you have to do is take some contact precautions, wearing clean gloves, wearing a gown, removing gowns before leaving a patient's room, washing hands with an antimicrobial agent. Now remember, this course is designed for the medical profession, so some of these things as citizens we probably won't have to deal with, but it's still good to know. And then they go in and they talk about some of the specific issues, like if you're dealing with anthrax, botulism, pneumonic plague, SARS, viral hemorrhagic fevers or VHFs. So there's quite a few that you have to be concerned. And so, public health actions. And threat assessment. So basically, law enforcement contacts the FBI. Because if we're talking about a biologic disaster, that goes right to the federal level. So basically, once again, you do the pre-disaster paradigm, which is planning and practice, resilience, education and training. That's the pre part. Then detection, incident management, safety and security, assess hazards, support, triage and treatment, evacuation and recovery. So that's Chapter 9, Biologic Disasters, under the Basic Disaster Life Support course. Once again, this is a free course most of the time. Hopefully it's offered somewhere where you can take it, and I highly recommend this course.